fimbria unite together to form a crest of the fornix. The two crura come together to form the body of the fornix, giving way to the column of the fornix and finally ending into the mammillary body. So they run all the way from hippocampus to the mammillary body. Hence, they have got the name of the hippocampomammillary tract as well. Uh, this is another name for the fornix. So also you can appreciate this yellow colored structure in the center, and this C-shaped structure that is a fornix is cupping around this yellow colored structure. So this yellow colored is nothing but the thalamus. And we can see that the lateral ventricle forms another big C around the thalamus. So if when we will be discussing the relation, we know that if this is the body of the lateral ventricle, it lies superior to the thalamus, whereas the atrium of the lateral ventricle lies posterior to the thalamus, and the temporal horn comes inferolateral in relation to the thalamus. Same goes for the fornix. We can see that the fornix forms a big chunk of the body of the fornix, forms the floor of the body of the lateral ventricle, and then it curves posteriorly around the pulvinar part of the thalamus. This is the pulvinar part of the thalamus, and we can see the crura of the fornix actually posteriorly curving around the pulvinar thalamus. Hence, it lies in the anterior wall of the atrium. And then once it's coming down into the temporal horn, we know that the hippocampus lies within the floor of the temporal horn of the lateral ventricle, and fimbria form a part of the medial wall of the temporal horn of the lateral ventricle. So moving on to the next picture, this is a view from above. We are seeing from the above. Now we can see that the red colored septum pellucidum comes within the midline. So if we talk about the medial wall of the body of the lateral ventricle, we know it's formed by the septum pellucidum, but we also know that it doesn't extend completely anteriorly. So anteriorly, there's a portion in which there will be the portion of the frontal lobe cerebrum that will be separating the two paired frontal horn of the lateral ventricle rather than septum pellucidum. We can further elucidate the relationship of the temporal horn. You can see the temporal horn in the relation to the body is actually located laterally. So temporal horn travels laterally and inferiorly, and it's located lateral to the body of the lateral ventricle. And in the temporal horn, you can see that this hippocampus lies within the floor, then fimbria of the fornix and the crura of the fornix are actually post in the anterior wall of the atrium. Both crura meet in the midline. There is a crus fornix, there's a commissure in between the two crura of the fornix that is known as the hippocampal commissure. And finally, at the level of foramen of Monro, this body gives way to two columns. And these columns actually curve in the anterior border of the foramen of Monro, going to end downwards into the mammillary bodies. You can see that thalamus is within the C of the fornix, and hence thalamus forms the floor of the body, anterior wall of the atrium, and in the medial wall of the temporal horn of the lateral ventricle. So this is another view of the lateral ventricle. This view is from front. We are looking from front to backward. So these will be the frontal horns, and this is the region of the body, and this is the region of the temporal horn, again showing the inferolateral relationship of the temporal horn to the body of the lateral ventricle. The rest of the relations remain same. The mammillary bodies can be clearly visualized as two paired structures in the midline that are joined via the fornix with the hippocampus. So in this picture, two other structures have been added. The one structure is this green colored structure, which was not in the last picture. So this green colored structure is actually the caudate nucleus, which is a part of the basal ganglia. The other basal ganglia being the putamen and globus pallidus. We know that putamen and globus pallidus and caudate nucleus together make up the corpus striatum. Whenever we say lentiform nucleus is made up of the putamen and globus pallidus, and if we say just striatum, it's made up of the caudate and putamen. So this is the caudate nucleus. It's also a C-shaped structure again, but it's slightly lateral to the other C-shaped structures we described. So it's lateral in relationship to the thalamus as well as in relationship to the fornix. So this one is also lateral to the lateral ventricle. You can see that this portion of lateral ventricle cannot be seen because we are looking at a lateral aspect, and the lateral ventricle is actually located medial to the caudate nucleus. The caudate nucleus again has got various portions. This region is the head of the caudate. Then we have got a body of the caudate. We've got a tail of the caudate, and the tail finally terminates within the amygdala. If you remember my last lecture of the temporal lobe anatomy, I told you that within the tip of the temporal lobe, we have got a medial projection, that is the uncus, and within uncus resides the amygdala. So this is the amygdala that actually resides within the uncus region. So this would be the tip of the temporal lobe. So amygdala forms the anterior wall of the temporal horn of the lateral ventricle, whereas the caudate lies slightly in lateral relationship to the temporal horn, and head of the caudate forms the lateral wall of the frontal horn of the lateral ventricle. The body forms the lateral wall of the body of the lateral ventricle, and then the tail again forms the anterior wall of the atrium of the lateral ventricle coming downwards, anterior and lateral wall. Also, in this picture, you can appreciate these red colored fibers. These red colored fibers are nothing but corpus callosum. And then you can see the various projections coming out from these red color fibers. These are actually the projections which are interconnecting the various areas within the two frontal lobe. We know that the corpus callosum is a commissural fiber, and there are fibers sweeping across from one cerebrum to the other cerebrum. Within the frontal lobe, these projections which connect the two cerebrum lobes are actually known as the forceps minor. And within the occipital lobe, these projections that are connecting the two cerebral lobes are known as the forceps major. So forceps minor and forceps major is spread out in both directions from the genu and the splenium and body of corpus callosum respectively. Also, there's a large sheet of fibers that I described last time, the white matter fibers, that goes backward and inferolaterally to cover the atrium on the lateral aspect. This sheet of fibers that originates from the splenium of the corpus callosum is known as the tapetum. So tapetum forms the roof and a major portion of the lateral wall of the temporal horn. Also, it forms the lateral wall of the atrium as well as the occipital lateral wall of the occipital horn. So this is the tapetum coming downwards laterally and going posteriorly. That is actually a white matter sheet for fibers arising from the splenium of corpus callosum. So again, this picture is from below upward. We are looking at the base of the brain. At the base of the brain, we can now see the all the structures that are previously described, barring the hypothalamus, which is not visible in this picture. You can see the fornix. You can see in relation to the fornix, the caudate is located slightly laterally. You can appreciate the head of the caudate that is actually creating a bulge within the lateral wall of the frontal horn of the lateral ventricle. Then you can appreciate the body forming the lateral wall of the body of the lateral ventricle. You can see how the tail curves downward and anteriorly ending in the amygdala, and hence the tail forms a portion of the medial wall of the temporal horn and a portion of the roof for the temporal horn of the lateral ventricle. While if we talk about the atrium, we already know that a portion of the anterior wall is formed by the fornix and the thalamus, and then this caudate also comes in its anterior wall. We can see these fibers which are connecting both frontal lobe with each other across the genu of the corpus callosum. These band of fibers are the forceps minor. Posteriorly, we have got the forceps major fibers, and we can see this red color sheet that forms the roof and the lateral wall of the temporal horn is known as the tapetum. Also, you can see that there is this flat sheet that is forming the floor of the frontal horn of the lateral ventricle. This flat sheet comes from the genu of the corpus callosum downwards straight. This is known as the rostrum of the corpus callosum. So again, a picture from anteroposterior direction, which shows the lateral ventricle in blue, the corpus callosum in red color. We can see that how the rostrum of corpus callosum and genu of corpus callosum come together to form the anterior wall and the superior wall of the body and the frontal horn of the lateral ventricle. We can see how the band of fibers known as the tapetum curve downward from the splenium and form the anterior and lateral wall of the temporal horn of the lateral ventricles. So this is now coming to the return anatomy. This is a view from above. We are looking from the above. The author has performed a craniotomy in this region. It is centered in the midline. So this is the interhemispheric fissure that we are actually seeing, and this is the sagittal sinus running within the interhemispheric fissure. So once the sagittal sinus and the other part of the cerebrum has been retracted, this is the kind of approach, not with this much of craniotomy, but with a small craniotomy. This is the approach that we usually do in a interhemispheric approach to the corpus callosum. So once we have applied retractors to the one cerebrum, we can see the midline fogs that is going downward. There's a double fold of dura. And we can also appreciate an important vascular structure that runs over the upper border of the corpus callosum. There's none other than the anterior cerebral artery. We know that it divides into two branches over here. One branch that hugs the surface of the corpus callosum, known as the pericallosal artery, and the other branch, which is slightly more superficial, is the callosomarginal artery, which run within the midline. These are again paired structures. So we have got callosomarginal, pericallosal of both sides. Also, you can appreciate that the superior sagittal sinus is actually draining various cerebral veins within it. This is an area which is usually devoid of any venous structures. So if we open up the corpus callosum, as we studied previously, we know that it lies in the superior surface of the body of the lateral ventricle. So if we open up the corpus callosum or we do a corpus callosotomy, we are going to enter within the lateral ventricle. So again, in this picture, the author has now performed a corpus callosotomy, and once he has opened up this corpus callosum, he's actually looking within the lateral ventricle. So this is a view within the lateral ventricle. He has magnified it. We are looking from above inside the lateral ventricle. Various structures can be seen over here, and these structures are more important to us because now we are dealing with the actual anatomy, how it looks inside. So this is also useful once you are doing a minimally invasive endoscopic third ventriculostomy. You don't open up the corpus callosum entirely, but once you go via the cerebrum into the corpus callosum, so anatomically you should know these structures. So you can see that this is the foramen of Monro, and this is the medial aspect. And here's the retractor that is retracting medially, and this is the lateral aspect. You can appreciate this is the floor of the lateral ventricle that we are seeing, and this is the medial wall. So this is the septum pellucidum in the medial wall of the lateral ventricle. We can appreciate that the head of the caudate, which was in previous pictures, you saw that how it's bulging within the frontal horn of the ventricle. So it forms a bulge over here in the floor. That is the head of the caudate nucleus, forming a part of the floor and a part of the lateral wall. Again, posteriorly, we know that in the midline, there were both fornix, both crura of the fornix joined together to form the body of the fornix. So this is the body of the fornix. And once it comes at the level of the foramen of Monro, it divides into the column of the fornix. This is the column of the fornix of this side that we are seeing, the right side. And it curves anteriorly around the foramen of Monro. So also important in endoscopic third ventriculostomy, if the foramen of Monro is not wide enough and you damage the anterior medial aspect of the foramen of Monro, you can cause damage to the fornix, which can lead to the amnesia within the patient. Also, on the lateral aspect, we have the caudate. So this is the septum pellucidum. We studied about the fornix. Then in this aspect, we have got the thalamus. So thalamus again forms the floor of the body of the lateral ventricle. Fornix forms the floor in the midline, and in the lateral aspect, we have got the thalamus forming the floor. There are also various other venous structures that are important that you can appreciate in this anatomy. There is an important vein, and it is known as the thalamostriate vein. As the very name suggests, thalamostriate means in between the thalamus and the striatum. So this vein runs in between the thalamus and striatum, hence it's known as the thalamostriate vein. We have got the striatum on this side, thalamus on this side. And then you have got an anterior caudate vein that is running the head of the caudate. We have got a septal vein, which helps us define the medial aspect. It's not clearly labeled over here. This one would be probably the septal vein. Also, we have got the choroidal fissure. The choroidal fissure runs in between the thalamus and the body of the fornix. So mind it that the choroidal fissure in the floor of the lateral ventricle will be between the body of the fornix and the thalamus. If we go posteriorly in the anterior wall of atrium, this choroidal fissure will be in between the pulvinar of the thalamus and the crura of the fornix. It will go within the temporal horn as well, continuing between the fimbriae of the fornix. And so this is the choroidal fissure, and this is the choroidal plexus that is attached within the choroidal fissure that we can appreciate over here. So this is a lateral view of the lateral ventricle. We can see relationship of the lateral ventricle to the third ventricle over here as well. This is the lateral ventricle. This is the roof of the lateral ventricle that is formed by the corpus callosum. This would one be genu, and this one is the rostrum of the corpus callosum. In the midline, we have got the fornix running all the way from the temporal lobe to the floor of the body of the lateral ventricle. This is the thalamus that is being shown in the lateral wall of the third ventricle. This is the massa intermedia that we can appreciate over here. So you can see that the lateral ventricle just lies above the third ventricle. So via the foramen of Monro, we can go within an ETV to approach the third ventricle, or another approach to the third ventricle could be by opening up the fornix via an interfornicial approach, or by splitting up in between the thalamus and the choroidal plexus. So again, a view from the top. These structures we already discussed. Just the septal vein is more clear in this picture. The septal vein lies medially. So to orient yourself to the right and left, you can localize that septal vein lies medially, whereas the thalamostrate vein is coming from the lateral aspect. So thalamostrate vein is usually lateral to the foramen of Monro. Also, this picture shows the relationship between our last lecture. In the last lecture we discussed regarding the insula, and we discussed about the surface anatomy of the insula. We can see that the insula is actually separated from this body of the lateral ventricle via this sheet of fibers in which various structures run. And this sheet of fibers is actually made up of claustrum, external capsule, internal capsule, extreme capsule, and various basal ganglia. This is the same picture that I just described, that how the lateral ventricles are actually related to the region of the insula and the sylvian fissure. Okay, this is for the schematic diagram. We have already discussed this one, but a few more concepts regarding the lateral isthmus I was describing. You can see that the head of the caudate is bulging within the frontal horn of the lateral ventricle. You can see that thalamus lies in the posterior aspect close to the lateral ventricle, and it forms the floor and as well as a part of the lateral wall of the lateral ventricle. We can see how internal capsule is related to the lateral ventricle in this picture. We can see that the anterior limb of internal capsule actually separates the head of the caudate from this lens-shaped structure. This lens-shaped structure is known as the lentiform nucleus, composed of two nuclei. The medially, we have got globus pallidus internum and externum, and more laterally, we have got the putamen. We can see that the genu comes to lie in close relationship to the lateral ventricle. So actually, the genu of the internal capsule comes in direct contact with the lateral wall of the lateral ventricle. And if we damage that lateral wall, we can damage the genu. And we know that within genu travel the important corticonuclear fibers. And then we have got the posterior limb of internal capsule. This one is located between the lentiform nucleus and thalamus, and within posterior limb, as we all know, run the corticospinal fiber, the neck, the body going down to the feet located posteriorly. So again, various structures have been labeled in this picture that travel through the internal capsule. We can see that within the anterior limb, we have got the frontopontine tract and the anterior thalamic radiation. Within the genu region, we have got the corticobulbar fibers, and from shoulder, arm, head, trunk, and foot represented posteriorly. Within the posterior limb, we have got the corticonuclear fibers. Also shown are the parts of the thalamus over here, the lateral and medial geniculate body. We know that medial, M is for music, is important for auditory radiation, whereas L, lateral geniculate body, is important for the optic radiations. So again, a beautiful picture from the anatomy of the roton. And this one, in this picture, we can appreciate this is the midline, and we can appreciate the foramen of Monro. We can appreciate the fornix coming in the midline and curving around the foramen of Monro. Head of the caudate can be appreciated. In this region, there will be the rostrum of the corpus callosum forming the floor of the anterior horn of the lateral ventricle. We can appreciate this vein that is running towards the foramen of Monro in between the thalamus and in between the striatum, that is the thalamostrate vein coming from a lateral aspect to go within the foramen of Monro. This region is actually known as a venous angle. So there's a U-shaped turn, because we know that thalamostrate vein is coming over here. It will take a U-shaped turn into the right roof of the third ventricle. So thalamostriate vein actually joins with this vein, that is the anterior caudate vein, to form the internal cerebral vein, and this internal cerebral vein will be traveling within the roof of the third ventricle in between the velum and depositum. So this U-shaped band of the thalamostriate vein coursing into the internal cerebral vein is actually known as the venous angle. It is important that where this venous angle is actually occurring in relationship to the foramen of Monro, if it's slightly posterior to the level of the foramen of Monro, you need to be careful when you are opening up the foramen of Monro to gain access to the third ventricle. Also, you can appreciate the choroidal plexus running over here in between the thalamus and the fornix. So this is the choroidal plexus, and this choroidal plexus will actually continue within the third ventricle as well, that we will be discussing in the next picture, into the roof of the third ventricle. So those structures which are forming the floor of the lateral ventricle obviously will form the roof of the third ventricle. In the midline, you can appreciate the septum pellucidum. The importance of septum pellucidum is a thin avascular structure, just the septal vein is coursing over there. So you can utilize it to do a pellucidotomy. If there's a bilateral foramen of Monro blockage, you pass an shunt on one side, you do a pellucidotomy, you can communicate both lateral ventricles with each other. So this picture shows various approaches that can be used to gain access to the third ventricle. In this picture, we can see that the author has actually separated the choroidal plexus on the side of the fornix. So it has separated the choroidal plexus attached by various small fibers known as the tinea fimbriae on the side of the fornix and tinea thalami on side of the thalamus. So you can open up the choroidal plexus on either side. You can open it up on the side of the thalamus. Some authors prefer to open up on the side of the fornix. So choroidal plexus has been separated from the fornix, and hence we can gain access to the roof of the third ventricle. So we know that within the roof of the third ventricle, I told you there are paired internal cerebral veins running. So this thalamostriate vein is actually taking a U-shaped band and coursing, continuing as an internal cerebral vein after joining the anterior caudate vein. So this is the venous angle, and this is the roof of the third ventricle, which paired internal cerebral vein run within the velum interpositum. So this is the third ventricle. We are gaining access via the lateral ventricle. So this was all about the body and the frontal horn of the lateral ventricle. A little bit orientation about the temporal horn and the atrium is mandated as well. So in this picture, you can see the caudate of the caudate and fornix can be seen over here. This is the fornix. We can see the column of the fornix uniting to form the body of the fornix. Then these are the crura of the fornix. Both crura are joining by the crest of the hippocampal commissure, and they are continuing inferolaterally into the temporal horn of the lateral ventricle, actually the floor of the temporal horn of the ventricle, to connect with the hippocampus. We studied about hippocampus, it forms the pes hippocampus. So if we talk about temporal horn, the floor is actually formed by this hippocampus, and then we have got the roof of the temporal horn that we previously discussed is formed by the tapetum. That is a red sheet of fibers that was coming from the corpus callosum. And in the medial aspect, we have got the tail of the caudate, finally ending in the anterior wall as the amygdala. So anterior wall is amygdala, tail forms the lateral wall, the floor is by the hippocampus, the floor, the roof and the lateral wall is by the tapetum. And then we have got this triangle-shaped area, which my arrow is currently indicating. It's the trigone of the lateral ventricle. The trigone of the lateral ventricle, again, is formed in the anterior aspect by the pulvinar, and by this fimbria that are actually the crest of the fornix that is actually coursing over here. And in the lateral aspect, we have got the tapetum. In the medial aspect, we have actually got the occipital lobe itself. So we know that from previous lecture that occipital lobe is divided into two structures, cuneus and lingula, by a calcarine sulcus. This calcarine sulcus forms a deep indentation into the medial wall of the atrium. So this would be the medial wall of the atrium. A deep indentation will be noted that will be formed by the calcarine sulcus known as the calcar avis. So I will show you this calcar avis in the next picture. This is another picture of the entire fornix. You can see that how it originates from mammillary body, form the two columns. The columns unite together to form the body, which are connected by the commissure of the fornix or the hippocampal commissure, form the crura of the fornix and terminates with the hippocampus. So again, the picture from the roton. Now in this one, he has dissected off the roof of the lateral ventricles to show a communication between the frontal horn body, the atrium, and then the temporal horn of the lateral ventricle. You can see that the hippocampal head lies in the floor of the temporal horn. The amygdala lies in the anterior wall of the temporal horn. We have got this collateral eminence, a bulge within the floor of the temporal horn of lateral ventricle that is actually formed by none other than the collateral sulcus we studied in the last lecture. We saw on the basal surface of temporal lobe, we have got a deep collateral sulcus, and this collateral sulcus forms an eminence within the floor of the temporal horn that is known as the collateral eminence. Also, its posterior continuation forms another indentation within the floor of the atrium as well that will be known as the collateral trigone. In the medial wall of the corpus callosum, we can see that there is an indentation by the calcarine sulcus that creates a bulge within the medial wall of the atrium known as the calcar avis. We can appreciate the bulb of the corpus callosum. This is the bulge that is created by the posteriorly crossing fibers of the forceps major. Those create a indentation within the medial wall of the atrium. This is superior in relationship to the calcar avis and known as the bulb of the corpus callosum. So in this picture, you can see that this is the lingula. This would be the calcarine sulcus, and the bulge of the calcarine sulcus created in the medial wall of the atrium is actually the calcar avis. So again, in this picture, the the temporal horn of the lateral ventricle has been shown. We can appreciate the choroidal plexus that is continuing within the temporal horn of the lateral ventricle along with the fimbria of the fornix. You can appreciate the anterior wall being formed by the amygdala, the floor of the temporal horn being formed by the hippocampus. Another picture, this one is slightly medial to lateral. So we are looking from a lateral aspect into the medial aspect. This one is the medial portion. This one is the lateral portion. We have de-roofed the temporal horn of lateral ventricle, and we are looking within the lateral ventricle. We can appreciate the hippocampus head and the body within the floor of the temporal horn. We can appreciate an uncal recess in between the amygdala and hippocampus, and we can appreciate this collateral eminence that is a eminence created by the collateral sulcus on the basal surface, continuing on to the atrium of the lateral ventricle. So another picture for your orientation, it has taken cut sections at 3 levels. So if we take a cut section at the level of the frontal horn, we can see that genu forms the roof of the frontal horn of the lateral ventricle, septum pellucidum forms the medial wall, caudate forms the lateral wall, rostrum forms the floor of the lateral ventricle. If we take a cut section within the body of the lateral ventricle, the corpus callosum continues, the septum pellucidum forms the medial wall, while caudate in the region of the body comes to lie more in the inferior aspect. As we saw, that caudate forms the lateral wall as well as the inferior floor of the body of the lateral ventricle. So here the caudate is within the floor. We can appreciate in the midline, we have got the fornix forming the floor of the lateral ventricle. We can appreciate the caudate forming the lateral wall of the body of the lateral ventricle, while these are the paired thalamus that are forming the floor of the lateral ventricle, and this is the fornix forming the medial aspect of the floor of the lateral ventricle. As we discussed, in between the fornix and the thalamus, we have got the important structure running that is known as the thalamostrate vein. Again, in this structure, we have taken a cut section at the level of the trigone of the lateral ventricle. So this is a cut section at the level of trigone. This is the medial wall at the level of trigone. This is the lateral wall at the level of trigone. We studied a band of fibers that travels downwards onto the lateral aspect of the trigone that is known as the tapetum. We studied about 2 medial indentations created within the medial wall of the trigone. The superior indentation by the forceps major is the bulb of the corpus callosum, and the inferior indentation created by the calcarine sulcus, this is the calcarine sulcus, is the calcar avis. And on the floor, the collateral sulcus in the floor forms another elevation within the trigone that is known as the collateral trigone. So this is the cut section at the level of the temporal horn. So we are looking at the floor within the temporal horn. So this is the superior wall and the lateral wall of the temporal horn that are formed by the caudate. In the roof, we have got the tail of the caudate that is just going to end here into the amygdala. Medially, we have got the portion of the lateral aspect of the thalamus and fimbria. In between the thalamus and fimbria runs the choroidal plexus. Okay, now we are going to discuss regarding anatomy of the third ventricle. I will be a little brief over here. So third ventricle is located just inferior to the lateral ventricle and medial to the lateral ventricle, because lateral ventricle are two paired structures on both sides, whereas third ventricle is a singular structure within the midline on both sides. It has got the thalamus, and interthalamic adhesion actually traverses the third ventricle. Also, third ventricle is important because various venous structures are related to the third ventricle. You can see this venous structure traveling within the roof of the third ventricle. This is the paired internal cerebral veins traveling within the roof of the third ventricle that will go on posteriorly to join the internal cerebral vein will go on posteriorly to join with the basal vein of Rosenthal and the precentral cerebellar vein to form the vein of Galen. And finally, the vein of Galen will join with inferior sagittal sinus to form the straight sinus that will travel on the superior aspect of the tentorium cerebelli to end into the torcular head. So this is another picture which is showing the third ventricle. This is the anterior portion of third ventricle, the body of the third and posterior portion of the third ventricle. The third ventricle has got two lateral walls. Both are formed by the thalamus and hypothalamus portion. And then it has got a roof, which is formed by the same structures which form the floor of the lateral ventricle. And then it has got an anterior wall over here, and then a posterior wall as well as a floor. So if we can look at the anterior wall, we can see that this is the foramen of Monro, from which the behind frontal horn of the lateral ventricle actually communicating with the third ventricle. Anterior to it, we have got anterior commissure, from which a white matter sheet runs straight downwards, known as the lamina terminalis. This lamina terminalis is then gives way to the chiasm. In relation to the chiasm, we have got two recesses into the anterior-inferior portion of the third ventricle. These are the chiasmatic recess, which is located anterior to the optic chiasm, and the infundibular recess, which is located posterior to the optic chiasm. So once we are within the region of the chiasm, then we are actually looking at the floor of the third ventricle. So we have got the chiasmatic recess, the chiasm, the infundibular recess. Finally, in this region, we have got the tuber cinerarium, mammillary body, and then going posteriorly, we have got pineal gland. So in relation to the pineal gland, we have got the habinula and the posterior commissure. So pineal gland, posterior commissure, and habinula form the posterior wall of the third ventricle. The structures forming the floor of the third ventricle form the roof. That are 5 layered structures. We have got 2 tila choroidi. In between them, we have got a potential space known as velum interpositum, within which runs the internal cerebral veins. Then we have got fornix superiorly and choroidal plexus inferiorly. So 5 structures: fornix, tila choroidi, velum interpositum, tila choroidi again, and finally choroidal plexus within the roof of the third ventricle. You can see that the choroidal plexus at the level of foramen Monro continues into the roof of the third ventricle. So going on to the next picture, this is an schematic diagram of the same, showing us various structures. The roof is labeled green, so you can see the fornix and the velum interpositum and tila choroidi running within the roof. The red is the anterior wall, that is the anterior commissure and lamina terminalis, and this is the optic chiasm. So above the optic chiasm, we have got the optic recess, and behind it, we have got this infundibular recess. Infundibular recess, minded in the depth of the infundibular recess, lies the pituitary gland and the infundibulum. Posterior to it, in the floor, we have got the tuber cinerarium. Posterior to it, we have got the paired mammillary bodies. And then finally, the floor continues into the cerebral aqueduct of the sylvius. If we talk about the posterior wall of the third ventricle, we have got the pineal gland. In relationship to it, we have got the suprapineal and pineal recesses. We have got the posterior commissure within the posterior wall of the third ventricle. The thalamus and the hypothalamus form the lateral wall of the third ventricle, separated by the hypothalamic sulci. So again, lateral ventricle, we open it up to gain access within the third ventricle. This region of the third ventricle is actually the velum interpositum. In this picture, the velum the tila choroidi has been peeled away to show the potential space in between the 2 layers of tila choroidi, within which run the 2 internal cerebral veins. Another important structure, and it runs within the velum interpositum, is the medial posterior choroidal arteries, which are the blood supply to the choroidal plexus. So this is the velum interpositum, the space being labeled with the yellow color highlighted in between the 2 choroidal plexus of the lateral ventricle in the roof of the third ventricle. This is the inferior layer of the tila choroidi that has been highlighted. Just above the inferior layer, you have got the two paired medial posterior choroidal arteries and the internal cerebral veins running in the roof of the third ventricle. And once that layer of the tila choroidi has been removed, you can look at the floor of the third ventricle. So this is the floor of the third ventricle. These are the two recesses that I just shown you. This is the optic recess and the infundibular recess. In between, we have got the optic chiasm. Here is the tuber cilium. This region would be of the tuber cinereum. So again, this structure has been labeled and the floor of the third ventricle has been opened. So this is the anterior commissure and lamina terminalis. Then in the floor, we have got the chiasmatic recess, the chiasm itself. Behind it, we have got the infundibular recess. This one would be the region of tuber cinereum in the floor, the two paired mammillary bodies, and then the midbrain. So this is the region just anterior to the mammillary bodies, is the region where we perforate the floor of the third ventricle during an endoscopic third ventriculostomy to communicate it with cistern and allo drainage of the third ventricle. So this is important from exam point of view. They will ask you where to perforate the third ventricular floor. Also important is that you can clearly visualize the basilar artery in this region so that you do not cause damage to it inadvertently. So this is an endoscopic view of the same picture. You can appreciate it via endoscope. Once you have passed from the foramen of Monro, you can look at the floor of the third ventricle. So this is the third ventricular floor. This is the region of the basilar artery, mammillary bodies on the both sides, and just anterior to this region of the mammillary body, you perforate the third ventricular floor. This is a view of the third ventricle from the basal aspect. We are looking from downward above, and you can see that we have the floor formed by the chiasm, followed by the region of pituitary stalk. Here is where the infundibular recess would be lying. We have got the tuber cinereum within the floor, and then we've got the mammillary bodies, and finally the interpeduncula fossa and midbrain, the posterior part of the floor. This yellow arrow is labeling from on the inferior aspect from where that perforation would be made into the floor of the third ventricle. So this is the enlarged view showing the posterior wall of the third ventricle. We can appreciate the region of the splenium being very important. We can see that the internal cerebral vein courses over here and is going to form the vein of Galen along with two internal cerebral veins, the basal vein of Rosenthal and paired pre-central cerebellar vein. So this pineal region comes into the posterior aspect of the third ventricle. This is the region of the third ventricle. You can see the pineal recess. Pineal recess, the pineal gland over here. Habenular commissure and posterior commissure can be appreciated into the posterior wall. And posterior inferiorly, we can see that it is communicating via cerebral aqueduct of Sylvius with the fourth ventricle. So just picture to gauge your anatomy. You can see the anterior commissure, lamina terminalis, mammillary bodies in the floor, midbrain, cerebral aqueduct. Okay, now just a brief overview for the fourth ventricle. So the fourth ventricle is a rhomboid shaped structure. It has got a floor, it has got a roof. The roof of the fourth ventricle is also known as the fastidium, as the floor is known as the rhomboid fossa. The roof is formed in its superior aspect by this sheet known as the superior medullary velum, and the inferior aspect by the inferior medullary velum and the tila choroidi. Whereas the floor of the fourth ventricle is formed by the various structures that lie within the pons and medulla oblongata that form the floor. So this is an image from the roton showing the third ventricle, cerebral aqueduct of Sylvius, and the fourth ventricle. We can see that within the roof we have got the cerebellum, in the floor we have got the brainstem that is made by the medulla oblongata and the pons. So this is actually a posterior approach. If you're going from a posterior side, how can we approach the fourth ventricular roof? So cerebellum and tonsils have been retracted on the one side, and you can see the inferior part of the roof that is formed by the inferior medullary velum and tila choroidi. This is in mind an important corridor for the tilovelar approach, in which we utilize this natural corridor. We separate the tila choroidi from the inferior medullary velum, and we can gain access without damaging the important vermian structures within an approach to the fourth ventricular tumors, the medulloblastoma or ependymoma, etc. So again, inferior medullary velum, the tilovelar junction. This is the roof of the fourth ventricle, more specifically the inferior portion of the roof of the fourth ventricle. So once we have opened up the roof of the fourth ventricle, we can look at the floor of the fourth ventricle. I will be concentrating mainly on the floor of the fourth ventricle because of the shortage of time, and also because it's important from examination point of view. We can appreciate a midline structure within the floor of the fourth ventricle that is dividing into two halves. This is known as the median sulcus. Just lateral to it, we have got this another sulcus that is known as the sulcus limigens. The sulcus limigens divides embryological basal plate from an LR plate. The LR plate forms the sensory structures within the brain, whereas the basal plate gives rise to the motor structures. So medial to the sulcus limigens, we have got the motor nuclei of the various nerves. In the and again, fourth ventricle is also divided into an upper portion and the lower portion by this stria medullaris. In the upper portion, we know that there is pons lying anteriorly. So in the base of the pons, we have got this prominence. This is known as the facial colliculus. It is nothing but it's actually the abducens nuclei around which the nerves of the facial fibers of the facial nerve run, forming a collicular structure and prominence within the superior part of the floor known as the facial colliculus. Damage to this structure will not only lead to the facial weakness, but also the weakness of the abducens nerve, which supplies the lateral rectus muscle. And more lateral to it, into the sensory area, into the LR part, we have got the vestibular trigone formed by the various vestibular nuclei. If we come into the inferior portion of the floor of the fourth ventricle, it is more important because it has got various trigones. Most severely, it has got the hypoglossal trigone with the hypoglossal nuclei resides. Then we have got a vagal trigone. And finally, in this region, we have got the area postrema. If you look at this structure, it forms like a pen of nib pointed downward. So because this is like a pen of nib, this is prominence also known as the calamus strictorius, which means the nib of a pen. So again, a more beautiful view of the floor of the fourth ventricle. The median sulcus can be seen. This pigmented area within the superior part of the floor of the fourth ventricle is known as the locus coeruleus, where the pigmented serotonergic neurons usually lie. And we can appreciate the superior peduncles and inferior peduncles over here. We can appreciate the sulcus limigens dividing the basal plate from the LR plate, and we can appreciate the inferior peduncle as well. Also, hypoglossal triangle, vagal triangle, and area postrema has been labeled. And finally, they give way to a central opening into the inferior aspect that is known as the obex, which is actually the medullospinal junction of the medulla oblongata into the spinal canal. So this highlighted green structure is the median sulcus. This is the prominence of the abducens nuclei, facial colliculus, hypoglossal triangle, vagal triangle, and the area postrema. This is the lateral recess of the fourth ventricle, via which it will communicate to the cisterns via the foramen of Lashka. This is the facial colliculus being highlighted with the abducens nuclei and the fibers of the facial nerve actually coursing around the facial colliculus. So this was all regarding the ventricular anatomy. I think I will conclude I will conclude my session over here, sir.
Yassar, do you have more slides? Maybe we can do it next week. I mean, it was a treat watching this lecture with you. Just
sir, I have a small slide, 2 to 3 slides on CP angle. Maybe I can do them today because next week we have cellular anatomy scheduled.
So maybe you can do it in the next 5 minutes.
Okay, sir. Okay, sir. So I had a few slides on the anterior anatomy of the brainstem. So I wanted to talk about it, the anterior anatomy of the brainstem. If you look, this one is the anterior anatomy of the brainstem. We have got pons in the center and medulla oblongata downwards. On the anterior aspect, these two prominences within the medulla oblongata are known as the pyramids, within which the large pyramidal tracts travel. And lateral to it, we have got these prominences caused by the superior olivary nuclei known as the olives. Why I'm talking about is because various sulci are over here from which various nerves are actually exiting. This sulcus is known as the pontomedullary sulcus. In between the pyramids, we have a sulcus, and then we have a sulcus in between the pyramid and pyramido-olivary sulcus, and then we have a lateral olivary sulcus from which the cranial nerves also exit. So if you can look at this picture, you can see that from pontomedullary sulcus, there's a nerve traveling on the anterior aspect of pons. This is the cranial nerve 6. In between the pyramid and olive exit the cranial nerve 12, that is the hypoglossal nerve. And lateral to the olive, we have got the 7th cranial nerve and 8th cranial nerve exiting, followed by the 9th, that is glossopharyngeal, 10th, that is vagus, and the 11th cranial nerve. So this is the region of the CP angle, and looked from an anterior aspect, we can see that the choroidal plexus is actually protruding out of the foramen of Lashka from the fourth ventricle into this region. And we can see the relationship of the various cranial nerves. We can see that it goes just inferior to the cranial nerve 7 and 8 complex, which is located just superior to this choroidal fissure and the floccular part of the flocculonodular lobe. So in this picture, I have highlighted an important artery that is arising from the midline basilar artery. This is none other than the anterior inferior cerebellar artery, which is related with the cranial nerve 7 and 8 complex along with the superior cerebellar peduncle. While in this next picture, I have highlighted a branch of the vertebral artery that is known as the posterior inferior cerebellar artery, which is related with the cranial nerve 9, 10, and 11. So this is the middle neurovascular complex, and this one is the inferior neurovascular complex. The superior vascular complex will be with the superior cerebellar artery and the trigeminal nerve, which has not been highlighted over here. So this is the view of the CP angle. Once you go within the CP angle, you retract the cerebrum away. You know this. This is the lateral aspect. This is the medial aspect. Cerebellum has been retracted away, so we can see the cranial nerve 8 exiting via the internal auditory meatus. 9, 10, and 11 can be seen. Cranial nerve 7 cannot be seen in this picture because it lies deep to the cranial nerve 8, more specifically anterior. So we have splitted up the cranial nerve 8. This is the superior vestibular, inferior vestibular nerve, and we can see that cranial nerve 7 is located anterior to this nerve. Also, an important artery is related to these structures, anterior inferior cerebellar artery, and a branch of this artery, that is known as the labyrinthine artery, travels into the internal auditory meatus. In the inferior complex, we have got cranial nerve 9, 10, and 11, which are related to the posterior inferior cerebellar artery. So this is the drilling of the internal auditory meatus we have done. This is the dura. Once we remove this dura, we can see the structures within the internal auditory canal itself. The relationship of these nerves within the internal auditory canal is important from an exam point of view. They have divided this canal into various compartments. We have a superior compartment and inferior compartment. We have an anterior aspect and posterior aspect. Into the anterior superior compartment, we have a facial canal. In the posterior superior, we have superior vestibular nerve. Both of these are separated by a vertical crest, also known as the Bill's bar. Then we have got a transverse crest that is separating it from the inferior compartment. In the anterior inferior, we have the cochlear area for the cochlear nerve, and posteriorly we have got the inferior vestibular area. So this is usually asked in examination, is important to remember. So I have shared a picture of Greenberg as well, in which the various structures have been labeled. We have got anterior superiorly facial, posterior superiorly superior vestibular, anterior inferiorly cochlear, and posterior inferiorly we have got the inferior vestibular nerve. Code or mnemonic can be LSU. LSU means the lateral semicircular, the superior semicircular canal, and the utricle being supplied by the superior vestibular nerve, while the rest being supplied by the inferior vestibular nerve. So, sir, I'm finished, sir.
Thank you, Dr. Yassar, for this detailed presentation. It was not in fact, it was not a presentation, it was a performance. And we covered, I think, most of the topics that are that is required for a trainee to give exam. I congratulate you on such excellent presentation, and I hope all the participants had enjoyed this presentation and gained a lot of information. Obviously, all the Dr. Pravat is appreciating your presentation, and I think we will see you all next week. Then I think we'll be discussing cellular anatomy next week.
Yes, sir, cellular anatomy, sir.
So thank you, Dr. Yassar, for such a detailed presentation. I mean, we can see all the hard work. We wish you best of luck for your exam and other participants as well. Thank you, guys. Take care of yourself.
Thank you, sir. Thank you.